Hello, and thank you for joining our webinar on tips for saving time and increasing engagement when implementing new health and wellness programs. I'm Reagan Corliss, and I'm a manager of strategy with MedSavvy. And real quick, I'll just go over some housekeeping items. If you wish to receive your SHRM and or HRCI credits, you need to attend the entire presentation. And in case you didn't select the option to receive the credits when you registered, just let us know by contacting us at the email at the end of this webinar. We will email you the certificates after this webinar. Also, you're welcome to submit questions at any time, and we will provide the Q&A after the webinar as well. Additionally, your feedback is very important to us, and we'd love to hear if you have any feedback or ideas for future topics on webinars in which you can earn CE credits or even shorter topics. A form will pop up at the end of this webinar in which you can submit your feedback. So we have a great list of speakers for this presentation, starting with John Parker. He is the Director of Operations at MedSavvy. His responsibilities also include overseeing account management with MedSavvy's employer customers, as well as helping them increase engagement in their wellness program with MedSavvy. Then we have Courtney Schwagler, and she is a cost containment strategist with advanced benefits, and she works with multiple employer customers as well. And lastly, we have Megan Boyd. She is a client success manager with Cambia Health Solutions, Human Performance and Wellbeing Division. So Megan Boyd is our first speaker. And as I mentioned, Megan is a client success manager with Cambia Health Solutions, Human Performance and Wellbeing Division. In this role, she partners with employers and brokers in the strategic development, implementation, and ongoing evaluation of health and well-being programs. Megan is also a certified wellness program manager, and she has a master's in organizational psychology. Megan has spent the last 10 years in the corporate well-being industry, servicing clients of various sizes, demographics, cultures, and industries. Her favorite part is partnering with different employers, rolling up her sleeves, and problem solving with the objective of building programs that drive sustained engagement and outcomes. So without further ado, I'll hand it over to you, Megan.
Thank you, Reagan, for that introduction, and thank you all for having me here today. My name is Megan Boyd, and I am a Client Success Manager with the Human Performance and Wellbeing Division within Cambia. Today, I'm going to be focusing in on tips for increasing engagement in wellbeing campaigns when time is scarce, which is certainly the case this year with COVID-19 distractions. I'm going to be outlining 5 tips for getting the most bang for your time buck this year with your campaigns. So let's get started. All right, so tip number 1, know your partners and lean in. An HR professional manages an average of 12 vendors in order to run their business. These vendors range from eligibility partners to insurance companies to health and well-being vendors. And even amidst this heavy vendor management load, it's important to know your vendors, but most importantly, identify your top partners. These partners are more strategic. They are ones that you look to in times of change, stress, or even global pandemics. As I think back on this year and some partners that we have within Beyond Well, we really had to look and adjust our focus in order to be able to partner through these unprecedented events of 2020. As our clients needed to turn their attention towards quarantine, to shifting their population to working full-time from home, we looked at ways that we could partner closer with them to be able to fill gaps during this time of need. So some examples of what we came up with as a team, you can see up here on the screen right now. These infographics help promote the new work environment that many of our clients found their employees in this year. We sent these to our clients as a way of helping add something colorful, something light and topical during this time of change. So the tip here is don't be concerned, know your partners and don't be concerned to reach out to your vendors for support. Share your current situation and leverage their creativity and their resources to help you get the word out about your campaigns this year. All right, so tip number 2, embrace technology to maximize the human touch. While it seems as though embracing technology would replace the human touch, I actually encourage clients to think about this a little bit differently. Focus on embracing technology to help with more mundane tasks, such as sending a promotion email, pulling reports, or keeping track of engagement. While, yes, a human can do these things and you are fully capable of doing them, when you dive into these types of tasks, you're actually limiting your ability to spend time on tasks that actually really do need you, such as evangelizing your program, securing senior leadership support, strategizing, and more. And so, an example that I like to think of in this case is a client of mine who we started working together a little over a year ago. And he was running a homegrown wellness program. He was so passionate, so outgoing and organized, and he had built one heck of a program. But he was spending copious amounts of time tracking engagement in different program areas to manage incentives, that he was spending more time with spreadsheets than he was marketing and championing the program that he had built. So when we started working together, I mentioned that I needed to do something about this death by spreadsheet, as I like to call it. We took many aspects of the program that he had built and scaled the efforts with reporting, with customized platform, and the result a year later was an increase in engagement across the board. Saved time for him, and most importantly, he felt more fulfilled with the activities that now filled his time. So the summary here, technology doesn't have to counter the human touch. Focus on looking for ways that it can actually expand it. So tip number 4, leverage your leaders. There really is no substitute for senior leadership support, period. It's hard to get around this fact within an organization, as it's really a natural byproduct of organizational structure. Employees look up to leaders within their organizations. They are natural role models, and they typically exemplify strong company values. So use this. Use this to your advantage. Grab a leader who you feel will be empathetic and enthusiastic regarding the campaign that you're launching and ask them to engage. Some examples of how leaders can get involved include perhaps a steps challenge or an activity. I like to use the example of a steps challenge called Beat the Chief, where you kind of pitch your employees against the step count of a senior leader within your organization. It can be very effective, it can be fun, and it can be a great way to get that leader involved in well-being within your workforce as well. Another example would be maybe it's a video message from a senior leader sharing a personal story or an experience that connects back to the benefit offering that you're campaigning at that time. Bottom line here, really don't be afraid to reach out to your senior leaders. Yes, they are absolutely busy professionals, but this can be a fun assignment for them. It can be a break from their regular routine, and it can provide them with a unique opportunity to really connect and have more face time with employees, which is a real win-win here. So make sure that you're leveraging your leaders. All right, last tip here, consider incentives. Incentives are a widely used tool within driving engagement across many programs, particularly in the well-being industry. Under most circumstances, a campaign or a program that's being offered will be personally interesting to a subset of your population, and they're going to naturally gravitate towards it based on their own interests, it's solving a problem that they have, and more. These individuals are more intrinsically motivated or personally motivated by the program or campaign that you're launching. Where monetary incentives can come into place and be handy is driving awareness and engagement with the other part of your population that may not be innately encouraged to dive into the campaign that you're launching. And don't think with incentives that you have to have a lot of dollars here. One way to control costs would be to raffle off a few larger incentives to those who engage in a campaign or complete an activity. Another tool that I like to look at here with incentives is the idea of setting a group engagement goal as well, where this is where you would add in additional raffles based on how many people actually engage in the campaign or program that you're running. So instead of raffling off just like 2 $100 gift cards as an example, if you hit 40% engagement from your population, you're going to raffle off 5 $100 gift cards. This can be a great tool to be able to start tapping into some of those other areas of communication, such as employee to employee, peer communication, encouraging others to join to be able to boost chances of winning that prize. And so in closing here, don't be afraid to look at incentives. Make sure to connect with your legal representative, your company attorney, if you have any questions in this particular area, but definitely encourage the use of incentives to drive engagement. All right, so there you have it. Megan's top 5 tips for increasing engagement and getting the most out of your campaigns with limited time. So just as a quick recap, the tips are: know your partners, embrace technology to boost the human touch, know your communication channels, leverage your leaders, and lastly, but not least, consider incentives. I appreciate you all having me here today to share some of these tips with you. In case you're interested, I wanted to take one moment to talk about the Human Performance and Wellbeing team within Cambia. We are headquartered in Portland, Oregon. The HPW team, as we like to call ourselves, is focused on delivering well-being solutions to employers throughout the United States, with our health plan wellness product, Regents Empower, as well as our carrier-agnostic product, Beyond Well. The HPW team provides products that cover about 1 million lives today. In case you're interested in learning more, you can visit our website at www.beyondwellhealth.com or email us at info@beyondwellhealth.com. Thank you so much for sharing your time with me today, and I'm going to hand it right back over to Reagan.
So now I'm going to introduce Courtney Schwagler. She is a cost containment strategist with advanced benefits. Bending the healthcare benefits cost curve is Courtney's primary focus at advanced benefits. As a registered dietitian, her viewpoint mixes clinical and practical application. The clinical aspect includes data analytics, identifying a company's gaps in care and actionable opportunities for savings. She then balances this with the practicality of what works for the client's current or evolving company culture. She helps lead employee education and launch wellness initiatives for happier, healthier, and more engaged members. So here is Courtney.
Perfect. Well, thank you. Yeah, I am Courtney Schwagler. I work with Advanced Benefits. We're located in Coeur d'Alene, Idaho, a very wonderful resort town. And my role as cost containment strategist is to provide support for about 25 of our self-funded clients with taking data, and my job is to give it a voice, to make it actionable. Part of that process is finding the right vendor partners along the way. So lots of my time is spent in vetting who are good strategic vendor partners that we need in our corner to really allow me to maximize my cost containment abilities. All right, so what we look for in vendor partners, I think this is really important to be patient in this process. I know it's exciting if we get the green light to start searching for a new vendor partner, but we might jump in a little too soon without asking the right questions and fully vetting who we are going to start working with. And I do want to say, obviously, it takes a lot of time to do this, but it's time well spent, because if you engage with a vendor partner and you find out it wasn't the right selection, you're investing way more time going through that whole process again. So just a note there. One great place to start is when you're looking at vendor partners is, do your visions align with theirs and their support model? If that doesn't work or seem to be apparent, then you'll always be fighting, in my opinion, an uphill battle, simply because you both aren't resonating together. So I think that's a very good foundational start. After that, we love to find someone that's nimble and accommodating. That's very important because I feel like we have unique asks when we look for vendor partners, and if they have more of a standard solution and you have to play by their rules and they can't bend, then at least for us, that's not going to be a good fit. So you need to know your non-negotiables when it comes to that. Primary point of contact. I love having a person that I know I can reach out to and depend on when I have questions. And as an HR professional, or depending on what role you have at your group, I think it's important for you to have access to them, whether it's that same person or someone different as well. When you have questions come up and you need that support, it's nice to rely on a person versus a support inbox. Also, kind of looping up to what we touched on, is embracing outside of the box ideas. That's why we like them to be nimble. So when we come to them with unique ideas, which we'll dive into here in a little bit in a few case studies, is that they don't laugh at you or they don't say automatically no. They entertain your idea and will work with you. Marketing dollars, this is a nice perk. Not that it has to be a huge budget, but when we do, let's say, on-site events, will they support you? Whether it be in gift cards, it's going to boost engagement and excitement amongst the employees versus you having to go to the CFO or to your company and say, hey, can we pony up for a vendor partner we already pay a fixed cost for and drive engagement through gift cards? It's nice when it's provided. And then on-site event support. So do you have, maybe it's that key point of contact, are they willing to come on site and support the event that you're hosting and engage with your employees? And finally, I love this, I found it to be super valuable, is will you be able to partner with these vendors and become a beta tester? So maybe what lots of these companies do behind the scenes is they have new solutions that they're working on to add to the solution you're already working with. And if you can become a beta tester, that means you have a voice involved and can really share what you think is missing and what would enhance the solution you're currently using. So if they offer that, or maybe you just need to ask, it's awesome being part of those teams. Okay, so what does this look like? Just gave you a long laundry list of things to think about as you start to engage down the vendor shopping experience. So how can they support you? Well, like I just concluded the last slide with, is on-site registration, promotions, and events. Having someone there with you, so you as HR or as an employer at this group aren't necessarily the faces. I think it's nice to have that third party and someone that's viewed as a professional in the solution that you're bringing to the employees. Gift cards. Again, this is just a really nice perk if they're willing to provide this, or some sort of raffle item, swag. It just goes over well. As we all know, everyone gets excited about that and are more likely to participate in what they're hosting. Custom flyers. So what you can see on this screen is an example of MedSavvy does create custom flyers. And by that, I mean we add in the company's logo. We have maybe a code that's specific to this employer group, and maybe even change the tone and the voice of some of these pieces that will resonate with the group. I think that goes a long way to have that versus just a generic material that you're circulating. Demo account. I love the idea of a demo account. Not sure if you've ever inquired about this, and not every vendor can provide this, but I know it's helpful. An example is we have one of our CFOs at one of our clients. They are not medically enrolled on the plan, and so they don't have access to a lot of the solutions that they're very hands-on and encourage their employees to engage in. So we've gotten her access to various vendors' solutions so she can understand what she's coaching people through. I think that's key for you to have firsthand experience and knowledge if you don't have a personal account. And then ad hoc reporting. I have a great case study on this where it's really nice to not only have a vendor that's going to support you and entertain your ideas of what reports you're looking for, but also not have a hefty fee that comes along with it. And then quarterly reports. So many companies will tell you they have quarterly reports, but where I've run into frustration when we've maybe gone down the road with certain vendor partners, I find out I have to be the one that puts in the ask, or I find that, whoops, we're a month past that quarter close and I still haven't seen the report. So finding someone, and MedSavvy is a fantastic example. I know by the 15th of the month that follows that close of that quarter, I'll have that report in my inbox. And so that's really nice to lean on. I don't have to babysit getting that material and that data. So here's an example of actually out of the quarterly reporting that I received from MedSavvy, where I'm a big believer in you can really only manage what you're measuring. And so by having reports that actually have reliable data, that's huge too. If you're not trusting the reports that you see or the data that's in it, that's an issue. So you need to be confident in what you're seeing. Now, this one is very, very helpful. Whenever you engage with a vendor, it's nice to ask them, can I see what quarterly reporting I can depend on, or monthly, whatever that cadence is? This report for me is very helpful. There are kind of two snapshots of it where MedSavvy will provide me with a report that says opportunities that are lying on the table. Now, what does this mean? That means that they've identified an employee or a medically enrolled individual that is on a medication that they can either think about stopping or possibly switching. And by switch, that's going from an equal grade or better grade medication and maybe even a lower cost medication too. When I take this kind of report to our clients, I can easily get dollars behind promoting this solution, and maybe it's a month-long promo and we do a big feature on MedSavvy or whatever that solution is, because behind the scenes the C-suite knows that there's maybe $26,000 lying on the table by us simply getting members engaged in that solution. So this is extremely valuable. A lot of reports I see, they're just fluff. So again, requesting what kind of reporting can you depend on and receive is very smart. Okay, this is a really fun case study and example. So a lot of the content that we're discussing today is how do we maximize the time that we have, because we're all strapped for time. So what I found to be very successful is find what champions or what leaders in your organization can you engage with and train on the solution that you maybe just got access to, and now you want everyone to access it. You want everyone to engage and activate their account. Well, instead of going to each individual person, which would be highly time consuming, instead you take the leaders. Maybe they oversee a certain department. And then what happens with that champion is they can train the rest. So for example, we have an automotive company is one of our clients, and I started to engage with a service manager who's been there for over 20 years, and he oversees about 70, 80 people in that service department. So that's key, and we'll get back to that later. But basically, he told me, he made just a flippant comment how he signed up for a high deductible health plan, and he thought he lost prescription coverage. And so I, of course, dispelled that myth that he believed, but we took it one step further. Because they have access to MedSavvy, and he was at his computer, we just popped right in to MedSavvy, logged in. He had already luckily activated his account, but didn't know how to use it properly. So what we did was we logged into MedSavvy and explored what those two medications were that he thought he lost coverage on. And we found out, one, specifically how does his benefit cover those medications, and how much does it cost him? We took it another step further and used the pharmacy finder tool, which is the picture you see there with the map. And what that tool does is it literally pings the pharmacies in whatever radius you're looking at, and it tells you how much it's going to cost. So now it's not a mystery when he shows up to, in this case, Fred Meyer's, to go pick up his prescription. What was a bonus was he found out the co-pays he was paying on the PPO plan he was on before were actually more than the cost of the medication. So it was a really exciting moment. Now, remember I said he oversees like 80 people? What was fantastic is I now had a champion through training this one individual. So I took some time, but now he's going out and telling all of those individuals he oversees, and they respect him. And he's telling them about this amazing solution that might save them money and help them navigate the prescription world. So that's a really good tactic. A little bit of time up front is going to go a long way. Okay, so one other example that I think is always important to remember. Technology is huge, it's amazing, but we're still using the technology with humans. So I think it's very important to keep in mind that while we have these high-tech solutions, that you need to find that nice balance of still having the human touch. So for example, this is an engagement I had with MedSavvy. What we were finding is, with the best of intentions, our clients were promoting, using the wonderful marketing material that they create, doing on-site promotions, but we still weren't quite getting those engagement numbers that we wanted or that the clients wanted as well. We knew there were dollars being left on the table thanks to those one reports that we reviewed earlier. So what we did was I called up MedSavvy, my key contact, and asked him, is there any way that we could get a report that tells us which employees have not yet activated their MedSavvy account, but had an opportunity to, again, either switch medications as an upgrade in the efficacy of the medication, or pay less. So we said, who has an opportunity to switch or possibly stop? Can you show us a report and maybe how many dollars are left on the table currently? So what we did was got that report, and from there, our team was able to make educational outbound phone calls to these members, just from a friendly standpoint of, again, education, and just telling them, would you like to activate your account? You might have a savings opportunity. All of this was made possible because they entertained perhaps our wild idea of reporting. And I'm sure it was a big lift behind the scenes, but they did it and without a fee. So it was wonderful having a partner to support us in that quest. So finally, my last case study before I wrap up. The other key topic we're talking about today, besides just saving time, which is very important, is engagement. So what we have found is, through something called an active contribution model or a premium incentive model, is that when you tie engagement to paychecks, perhaps in the form of, in this case, premiums, and how much people are paying for their healthcare, that gets their attention. Now, these certain activities you tie to it, not everyone's going to be in love or instantly engaged or using the solutions, but what you're doing is you're creating a channel for them to at least be exposed, because what we have found when we implement something like this, our engagement rate goes from about a 20–30% engagement rate to about an 80 to 95%, depending on the group, which is huge. So we think that's a big win. And so in the case of, say, a MedSavvy, or you have a wellness solution, or a telemedicine solution, what you want is just people to know they have that benefit and to activate that account. So an example is of what we have tied to this is as the well exam, lab works, telemedicine. The last thing you want to do when you're sick is create your telehealth account. So that one's really nice to have established up front. And then MedSavvy is very important too, because even if I don't have a prescription today, but I'd walk in the doctor's office because I'm sick and I'm prescribed an antibiotic, I want that account set up so I can start shopping. And so what that has done is dramatically increased exposure and engagement in our bolt-on solutions. So it's something to think about. We know it's not right for every company, but we appreciate the partnership. Again, going back to that vendor partnership, that MedSavvy, they provided us with a scavenger hunt for one of our groups that wanted to make it fun and interactive for someone to explore what the solution has to offer. All right, well, to wrap things up today, what I would suggest is to not settle on a vendor solution. Instead, take the time up front to properly vet who you're going to partner with. If you find the right partner, they're going to save you time in the long run and also help you boost engagement for all of your members. if you're curious to learn more about advanced benefits, you're welcome to reach out to us. You can check us out on the web at trustab.com. We service groups small as 2 and anything above. So my personal specialty here at Advanced Benefits is in the self-funded group, which would usually be about 50 lives and above. So don't hesitate to reach out if you want to learn more. We are a shop that's independently owned and operate out of Coeur d'Alene, Idaho. Been doing it since 1995. Thank you for your time today, and hopefully you got a few valuable nuggets from what was shared.
So now I'm going to introduce you to John Parker. He is Director of Operations for MedSavvy, which is a service that helps people and their healthcare providers make better medication decisions. MedSavvy provides easy access to medication safety, effectiveness, and cost information, as well as concierge pharmacists. John has 15 years of experience managing medical and pharmacy adjudication technologies, including 9 years in pharmacy operations and management. So John, I'm going to hand it over to you now.
Thank you, Reagan. First of all, my team is responsible at MedSavvy for all of the client implementations, all of the engagement, as well as account management. Based on that experience, we're going to share some tips with you today and some of our experiences around saving time and resources implementing new programs. First of all, the problem you're very, very aware of. It is fact that HR executives are very busy. First of all, your first priority is the care of your employees. You're taking care of them on a daily basis. There are life events, you know about the births, the marriages, all of the troubles that come across your employees, and they're talking to you daily, and you need to be available for them. When they do have to access their benefits and they need it, you need to be available for them to be able to know how to take advantage of those benefits that you've provided for them. Among other responsibilities you guys have are all of the legal and regulatory compliance issues. These are usually time bound or constrained and kind of enforce their own priority into your schedule. We have management employee relations, making sure everybody's getting along, policies are being adhered to. That's another drain on your daily resources. Hiring and firing. And even in these times, we've got layoffs and other uncertainties that are taking a lot of your time. And HR staffing. I've yet to come across an HR staff that has been overstaffed. So given all of these demands on your time and resources, how do you go about implementing a new program? So we have some challenges. Let's kind of take a look at what things that are going to inhibit us from getting this new program in. First of all, engagement is just not easy. You have to get the attention of your employees and you have to reach them where they are, depending on what kind of a business you have. Your employees may be in an office, they may be out in a warehouse or even in trucks out on the road or spread across the nation. How do you get to these people? Timing is important with programs, right? If somebody doesn't know how it will really help them today, they don't pay attention and they maybe don't register today and wait till the time of need. We try to get people to sign up at that time. A good example is for telemedicine, we try to tell people that you don't want to be signing up while you're feeling sick and you need to talk to a doctor. Get those registration things out of the way so that when you do need the service, you can get to it. But again, people just aren't paying attention until they need it. Email communications or that lack thereof is really a big inhibitor to our engagement. We don't know if people are reading their emails. They do receive so many emails now. There are other things like IT department email policies that are just there for security. We know about the phishing scams. We know about all the other security issues that come with outside emails. And we want to make sure that we get beyond those and get to your people. So what do customers want when they're implementing a new program? Well, they want partners, not just products. They want somebody who's going to help them get their product out there in front of their people and get it used. They also want the kind of the right amount of time to be spent on this. They want the right person in front of their employees that can encourage them to use the products and engage with their organization. Of course, that all drives engagement, which is the goal, because we know that engagement is what drives results. So here's some ideas in dealing with some of those constraints. We've got some best practices that we've learned here. First and foremost, outsource what you can to your vendor. Talk to your vendor about what they will provide for you. Maybe even negotiate new things into the deal as you're talking about bringing on a new provider. Some of the things that they can do, what you want to think about is copywriting. They should know enough about your organization to be able to write in your voice, leading you only to do some minor edits. They can do emails, articles for you, maybe even some blogs. Printing is important. You want to get materials out, whether those are flyers or posters, even mail to the home. Having those articles printed for you can save a lot of time and energy on your side as well as money. Mailings to home, another good way to reach employees. Can they do those mailings for you? Executive support, and it sounds kind of silly that it's something that you can outsource to your vendor, but it's not the support, but it's the support of your executive. If you can ensure your executive that we're not going to be a time suck for them and that you're going to be providing them with slides, talking points, other ways that they can be in front of your people supporting the product without it being a big drain on them, using your vendor to help support them with those materials, they may be more likely to step up and support this implementation with you. It's really important to play to the culture. Know your company, know what drives your people to adopt new programs, know what communications work. You want to use the most effective communications channels and use them often. You want to think about other things like incentives or gamification. Do they respond to incentives? Do you have a competitive group or maybe a set of divisions that you can have pitted against one another in some kind of a gamification? Another important thing is what's in it for me? Why is it important for me now? We talked earlier about the fact that people might not sign up if they didn't see the immediate need for a product. What we like to do is use real life stories, testimonials, showing how the product actually helps real people solve real problems every day. It brings it home, probably gives them a little bit better idea of why they would sign up for something, or maybe at least a little more interested in signing up. I'm going to talk about a couple of case studies here. We thought we would go through one that didn't work well because it's good for us to learn from our mistakes. In this case, it was a small multi-location hotel chain. Just about 3 hotels. Immediately, we had some leadership communication challenges. Each hotel had its own manager who oversaw the location's communication and registration. It was kind of delegated to them. They weren't really invested in it. Just another thing for them to do off the side of their desk, kind of like HR execs have to deal with. They had no incentive. There was no bottom line incentive to them, no bonuses, no kind of reason for them to really get invested. That gave us no single point of contact. When I was talking to them, I was talking to all 3, and we had a lot of, yeah, we will do that. Nobody did it. It was very hard to get one person so that I could hold them accountable and that I could work with them on a regular basis to get results. We also were not able to do invitations. In this case, and that's email invitations. So a personal email invitation really drives a lot of engagement. We like to do that whenever we can. But in this case, the demographic of the employee was that they were part-time to full-time. They really didn't have any employee emails, and they didn't ask for employer or employee email, so they didn't have a list to give us. So we were not able to send out those very important personalized invitations. When we've surveyed our customers, about 50% of those customers say invitation emails are the most important way to engage their employees. So we like to do that. In this case, we weren't able to do that. So when we do invitations, we see above 30% registration rates and higher. And when we aren't able to, we can see in the single digits. So being able to reach out to them in that important email communication is a key to success. Another thing that didn't work for us was we had talked about using trainers within their organizations, and we were going to train those trainers. But back to that first point, we never did get fully engaged with those managers. I was never able to get the trainer meetings scheduled, so the trainers really never came up to speed, never did any of the training, never did reach out to the employees, and that was reflected in low engagement also. Another thing that made this more complicated was this staff would float in and out of benefits based on their time worked. So they were part-time, and sometimes they would be over the amount of hours it took to be benefited, and then they would slide back out. Maybe some of you have that issue, but that made it more complicated to explain to them how to use a product when they were in the benefits versus outside of the benefit. Let's go to something that was a little bit more successful. Again, it was a tough engagement for us to go through, because this is a large convenience store retailer. Think of this: hundreds of stores, small staffs, spread out over many states, also multiple shifts, not a highly technical group of people. So we had some things that we had to overcome, yet we were able to do that. One of the best advantages we had there was we had HR actually had strong executive support. One of the executive leaders even was able to send out a communication to the employees. We authored that, by the way, so that he only had to make small tweaks to it. He also did some other stand-ups in groups, so he was charismatic and well looked up to leader, so that helped a lot of people to get on the band. So we were able to send out invitation emails. So they didn't have corporate emails, but they did collect and have personal emails. So we were able to send personal emails to most of their employees, and that helped us out a lot. We also worked with incentives with this group. We did two kinds of incentives. One of them was every employee who signed up for MedSavvy was able to be entered to win a gift card. We also did a contest at the store managers level. So store managers were encouraged to get 100% of their people registered, and they were eligible for a prize if they were able to get to that level. We did another round of education with the regional managers so that they knew about the product and they could talk to managers about the product or employees about the product as they went around to their regions and met with employees. We also sent postcards to homes. So in this case, we're reaching out to those members of the family who might be in charge of healthcare but are not actually the employee. So we're able to send that communication to home, letting those people know that they're able to register and engage. Another thing we did with this group was they had a high Spanish speaking population, so we were able to supply Spanish materials as well as English materials. So MedSavvy is a tool. It integrates directly with your benefits. I mentioned that earlier. So based on that, we're able to provide employees with medication costs. We also have a pharmacist team that provides effectiveness grades as well as side-by-side comparisons. We send out safety and cost savings alerts to employees. You're able to talk to a pharmacist if you want to, if you still need to do a consultation, and we also do a thing called a medicine cabinet check where all of your drugs together can be compared, and you can be given a review and find out whether you can get to a more effective drug or a lower costing drug. We can customize many of our programs to your health plan and to your region or your location. So if you've got any special benefits that we need to highlight, we will make sure that we will highlight those. That about wraps it up for me, and I'm going to turn it back over to Reagan to continue the webinar. Thank you.
So thank you so much for attending this presentation. I hope you found the information helpful. If you'd like additional information or have additional questions or feedback, please email us at this address, marketing@medsavvy.com. Additionally, once we have your email, we will provide an email link to this presentation after this event. And we'd love to hear your feedback with any ideas you have for future topics for webinars, presentations where you can receive CE credits, and also any feedback you have on this presentation format. Thanks again for attending.